Rheumatology is a subspecialty in internal medicine and pediatrics, devoted to diagnosis and therapy of rheumatic diseases. Clinicians who specialize in rheumatology are called rheumatologists. Rheumatologists deal mainly with clinical problems involving joints, soft tissues, autoimmune diseases, vasculitis, and heritable connective tissue disorders. Many of these diseases are now known to be disorders of the immune system, and rheumatology is increasingly the study of immunology. Rheumatism. Rheumatism is a colloquial term referring to any painful disorder affecting the locomotor system including joints, muscles, connective tissues, soft tissues around the joints, and bones. This also includes rheumatic heart disease, which is specific to heart valves but has symptoms similar to rheumatic fever, which typically develops after a streptococcal infection. Rheumatologists are clinicians dealing with arthritis and other rheumatological disorders such as rheumatoid arthritis, ankylosing spondylitis, gout, systemic lupus erythematosus. One of the major changes in modern rheumatology is the development of new drugs called biologics, or disease-modifying agents, which can control severe disease more effectively. Rheumatologist. A rheumatologist is a physician specialized in the field of medical subspecialty called rheumatology, and holds either a board certification after specialized training after attaining a medical degree through fellowship programs in the United States, or specialist registrar positions in the United Kingdom, or DM in India or equivalent programs elsewhere in the world. In the United States, training in this field requires 4 years undergraduate school, 4 years of medical school, and then 3 years of residency, followed by 2 or 3 years additional fellowship training. The requirements may vary in other countries. Rheumatologists are internists or pediatricians who are qualified by additional postgraduate training and experience in the diagnosis and treatment of arthritis and other diseases of the joints, muscles and bones. Many rheumatologists also conduct research to determine the cause and better treatments for these disabling and sometimes fatal diseases. Treatment modalities are based on scientific research. Currently, practice of rheumatology is largely evidence-based. Rheumatologists treat arthritis, autoimmune diseases, pain disorders affecting joints, and osteoporosis. There are more than 200 types of these diseases, including rheumatoid arthritis, osteoarthritis, gout, lupus, back pain, osteoporosis, and tendinitis. Some of these are very serious diseases that can be difficult to diagnose and treat. They treat soft tissue problems related to musculoskeletal system sports-related soft tissue disorders, and the specialty is also interrelated with physiotherapy, physical medicine and rehabilitation of disabled patients. Patient education programs and occupational therapy also go hand in hand with this specialty. Diseases. Diseases diagnosed or managed by the rheumatologist include degenerative arthropathies, osteoarthritis, inflammatory arthropathies, rheumatoid arthritis, spondyloarthropathies, ankylosing spondylitis, reactive arthritis, psoriatic arthropathy, enteropathic spondylitis, juvenile idiopathic arthritis, crystal arthropathies, gout, pseudogout, septic arthritis, systemic conditions and connective tissue diseases, lupus, Sjögren syndrome, scleroderma, polymyositis, dermatomyositis, polymyalgia rheumatica, mixed connective tissue disease, polychondritis, sarcoidosis, vasculitis, microscopic polyangiitis, Churg-Strauss syndrome, Wegener's granulomatosis, polyarteritis nodosa, Hennig-Schär purpura, serum sickness, giant cell arteritis, temporal arteritis, Takayasu's arteritis, Bihar section A syndrome, Kawasaki's disease, Buerger's disease, Ehlers-Danlos syndrome. Soft tissue rheumatism, local diseases and lesions affecting the joints and structures around the joints including tendons, ligaments, capsules, bursae, stress fractures, muscles, nerve entrapment, vascular lesions, ganglions, localized soft tissues disorders. For example, low back pain, tennis elbow, golfer's elbow, Ohlkranien bursitis. Diagnosis. Apart from an extensive medical history, there are useful methods of diagnosis both performed easy enough in a physical examination and, on the other hand, more complicated ones, often requiring a rheumatologist or other specialized physicians. Physical examination. Following are examples of methods of diagnosis able to be performed in a normal physical examination. Schober's test tests the flexion of the lower back. Multiple joint inspection, musculoskeletal examination, screening musculoskeletal exam, a rapid assessment of structure and function, general musculoskeletal exam, a comprehensive assessment of joint inflammation, regional musculoskeletal exam, focused assessments of structure, function and inflammation combined with special testing. Specialized, laboratory tests, ANA, X-rays, ultrasounds, and other imaging methods of affected joints, cytopathology and chemical pathology of fluid aspirated from affected joints. Treatment. Most rheumatic diseases are treated with analgesics, NSAIDs, steroids, DMARDs, monoclonal antibodies, such as infliximab and adalimumab, and the soluble TNF receptor etanercept and methotrexate for moderate to severe rheumatoid arthritis. Biologic agent rituximab is now licensed for use in refractory rheumatoid arthritis. Physiotherapy is vital in the treatment of many rheumatological disorders. Occupational therapy can help patients finding alternative ways for common movements which would otherwise be restricted by their disease. Patients with rheumatoid arthritis often need a long-term, coordinated and a multidisciplinary team approach towards management of individual patients. Treatment is often tailored according the individual needs of the individual patient, which is also dependent on the response and the tolerability of medications. Scientific research. Recently, a large body of scientific research deals with the background of autoimmune disease, the cause of many rheumatic disorders. Also, the field of autoimmunology has emerged to further examine the interactions between the immune system, joints and bones. Epidemiological studies and medication trials are also being conducted. Scientific research on biologics and clinical trials on monoclonal antibody therapies have added a new dimension to the medical treatment of arthritic disorders. References: Rheumatology 2012 Dec. 51 SUPPL 6, by 28-36 doi, 10.1093 Kes 278. http www.rheumatology.org Clinical What is a rheumatologist / methotrexate for rheumatoid arthritis. Arthritis.about.com. Retrieved June 24, 2013. Edwards J., Szczepanski L., Sokinski J., Filipowicz Sosnowska, Emery P., Close D., Stevens R., Shaw T. Efficacy of B-cell targeted therapy with rituximab in patients with rheumatoid arthritis. N. Engel J. Med 350, 2572 Euro 2581. doi, 10.1056/NEJMOA032534. PMIDA 15201414. External links, American College of Rheumatology, European League Against Rheumatism, Consortium of Rheumatology Researchers of North America, Incorporated, British Society for Rheumatology, Canadian Rheumatology Association, Association of Rheumatology Health Professionals, Future Rheumatology Journal Cutting Edge Commentary and Analysis in the Field of Rheumatology, Indian Journal of Rheumatology, What the Heck is Rheumatology?